All right. Isn't this wonderful? It's Nikki Thomas in the afternoon, KBLX family. We have another informative, exciting conversation today. And I'm sure you've been hearing it on the radio. Together we heal. And it sounds amazing. That's because it is amazing. And we've got more of your questions answered today because we have an expert in the building. She is Dr. Navina Baba from the San Francisco Department of Public Health. How are you today?
I'm well. Thank you so much for asking. It's my pleasure to be here.
I love it that we have a doctor in the house because all the questions that we have about COVID, about the vaccine, it's so interesting. It's an ongoing dialogue that's happening right now that's so important. And the Together We Heal campaign is doing an excellent job of doing just that, bringing the community together in an effort to heal and to provide the information and the resources that we need right now. So tell us more about the Together We Heal campaign and how it all began.
Yeah, excellent introduction about the Together We Heal campaign. So the campaign is really an awareness campaign. It was born out of the community and has really been community driven and led, which makes it so exciting. It's an awareness campaign that talks about how, people within the community are protecting themselves and each other and their families and their community members, all the actions that they're taking. At the beginning of the pandemic, this was included getting testing and ensuring, that they were masking and socially distancing, and that continues. And it's evolved to, as vaccines have enrolled, to getting vaccinated. So it really highlights the unsung heroes, the frontline people that are doing this work, and all of us, in fact, in the ways that we are protecting each other. So it's a tribute to that. It's a reminder of all of that we've been through and where we've come and where we're going. So it's a campaign that it is centered on our communities that have been most impacted by COVID, which includes our Black African American communities and our communities of color.
I love the idea of putting some extra on coming together at this time because it's one of the loneliest times. Because we could have a whole nother conversation about how lonely it is to speak to all the things that we've been through. The lockdown, the isolation, the stay home, are there going to be enough supplies for me? So the word together is just very powerful right now. So how is San Francisco ensuring that equity plays a role in the distribution of the vaccines?
Yeah, one of the things that, the fact that the pandemic has really impacted our communities of color. We were very intentional in how we rolled out vaccine. And we worked with our healthcare partners as well as our community partners to ensure that there was low barrier access to vaccine. And so our mass vaccination sites, we intentionally set them up in more of the southeast quadrant of the city. So the Market, City College, and then also in Moscone and south of Market. All again, very intentional that we wanted to make sure that the communities that were hardest hit by COVID also had first priority access to vaccine. Mm-hmm. Additionally, we've done a lot of neighborhood community events with our community-based partners to ensure that if people don't want to go to a big center, that they have, maybe a small local area that they would feel more comfortable going to, they have access to, they can ask questions. And then obviously partnering with the medical community because people really do trust their doctors and want to get that one-on-one. And so ensuring that vaccines could be made available in healthcare systems as well.
Okay, so doctor, I'm going to hit you with a bunch of the hardcore vaccine questions. These are always my favorite because at a time like this, it's like folks want like some definite answers and they want to make sure that they've got the facts straight. So does the vaccine contain the live COVID-19 virus? What are the ingredients found in the vaccines? And can these ingredients be found in other vaccinations, medicines, or things we use in our day-to-day lives?
So for the first question, none of the vaccines contain Lyme virus. In fact, none of the vaccines contain the entire virus. Almost all the vaccines have been developed from a piece of the virus that your immune system is able to respond to. So how I like to think about this is what the vaccines do is it gives you a recipe for your body to defend yourself against COVID. And so if you think about it kind of as an analogy, if the first time you've ever eaten cake, and it's probably, many years for a lot of us, but if you just think back to that moment, if you thought, well, gee, I want to make that, but you had no recipe, think about all the things that you would have to try to do, right? You would have to try to figure out, well, it tastes a bit sweet, so I should buy some sugar. And if you, or if you ate a chocolate cake, you'd think, oh, well, maybe there should be some chocolate. But most of us would probably have a disaster of a cake without a recipe, right? And it's the same with the virus. The first time your body sees the virus, it may not know what to do, and the virus may overwhelm it, and that's why we get a lot of bad outcomes from COVID. But if we can give your body the roadmap of how to protect itself, just like we have a recipe to make a cake, you will have a much better outcome. And in fact, these vaccines are so effective that the majority of people don't get disease at all, and the minority that do, it's very mild disease. So that is just one explanation. And what we give you is one ingredient to ensure that your body can protect itself against the vaccine. So no live vaccine, and just one small ingredient that is taken from the virus but is not live. And then in terms of the actual what's in the vaccine, you're right that there are things in the vaccine, but there are inactive ingredients that allow the vaccine to be viable in terms of being able to get into your body. But these are all things that are found in normal everyday foods and medicines. So most of us are exposed to these inactive ingredients on a regular basis, and they don't pose any harm unless there's one specific case. If you have a specific allergic reaction to one of these ingredients, it might cause harm, but that allergic reaction is very rare.
Wow. I think the analogy about the cake was the best answer that I've heard in this entire pandemic.
Oh, that's great.
Seriously, that's something that I was in the dark about. And as you answered the question, I was like, oh, wow. Everything made sense because we were seeing so many stories at the beginning of the pandemic about the virus overwhelming the body. And, as we go along, it just makes sense that, the explanation that you just gave us, it made everything make sense in my head. That it's just excellent. Wow. Okay. So what resources would you recommend for someone wanting to educate themselves and make an informed decision on getting vaccinated? Because that's what we're all trying to do right now.
Yes. And I think there's a couple different resources I can point to. One is, the CDC has guidelines, the California Department of Public Health has guidelines, and our own, government, sf.gov has a lot of great resources. So I would say those are all good places to find good information and correct information. The other thing that I would say is if you are listening to this and you've gotten vaccinated, you are like one of the best people to talk about vaccine and why you got vaccinated to your loved ones, to your neighbors, to your community, if you made that decision and what kind of compelled you to make that decision and why you felt it was the right decision to you. Because it is those one-on-one conversations that really help to get the right facts out there. We also know that people trust their doctor, and we are making doctors available at our vaccine sites to answer questions. So if you do have questions and you're in San Francisco, we can definitely accommodate that. But I always think the people that have gotten vaccinated and the choices of why they've decided to are one of the most powerful tools we have. So I would really encourage you, if you have questions, to talk to somebody that's gotten vaccinated or talk to your doctor. And if you have been vaccinated, to kind of spread the word.
Amazing. Amazing. I'm so glad that we get together for conversations like this because they really, really allow us to feel empowered and also shift into a decision one way or the other. Again, there's so much information that we get. I mean, our phones are great technology, but at the same time, it can lead us down all these different rabbit holes and you just don't know which way to turn sometimes. So this has been an amazing conversation. And again, I feel like the weight has been lifted and now I see the light. And everything is just coming together in the brain right now. So if you want more information, you can go to sf.gov, and all the things that we've talked about, there's resources, there's information so that you can make an empowered decision. Nobody likes to feel like somebody's making decisions for them. That's the other thing. So again, when we say together we heal, it's not just a one option thing. It is, hey, we're coming together for conversations and for informations and to clear the air and to get the proper information to everyone who wants and needs it. Dr. Navina Baba, San Francisco Department of Public Health, thank you so much for this. You don't even know. It's almost like I feel like I'm we're on Facebook a lot and I'm in church too. I feel like I'm in church because I'm like, preach, sis, preach. This is amazing. Awesomeness. Again, sf.gov, KBLX family, for more information and for more resources. Together we heal. I could not have said that better. Dr. Navina Baba, thank you so much for your time today.
Oh, my pleasure. Thank you so much, Nikki. Take care.
Thank you.